And one. A hearty good afternoon to everyone, and welcome to our session on the topic of vaginal discharge and personal hygiene. We are pleased to have Dr. Neera Kirpal MBBS, PGO, and Senior Consultant in Obstetrics and Gynaecology from Apollo Cradle and Children's Hospital, Amritsar, among us, to educate and to shed some light on this topic. Doctor, you have the stage.
Good afternoon, everyone. My dear friends, so today I plan to talk about vaginal discharge. So, we get lots of patients every day with complaint of vaginal discharge. That's a very common problem in patients and ladies. Very common problem. Maybe married or maybe unmarried, maybe pregnant patient. So all patients they usually come with vaginal discharge. So today I will talk because what is vaginal discharge? It's usually vaginal and cervical. We have normal glands in vagina and cervix. So they secrete secretions, which is a vaginal discharge. So there's a normal bacteria and there's a normal yeast infection and yeast in the vagina, which keep our vagina healthy. And discharge is a natural process to keep your vagina clean, free of discharge. But in case there's a loss in the balance of bacteria and fungi, so that gives excessive problem, excessive discharge, which we call as vaginal infective discharge. That's vaginitis or vaginosis. सो ये ज़्यादा प्रॉब्लम जो है ये बहुत लोगों की नॉर्मल होती है बिकॉज ऑफ नॉर्मल प्रोसेस इन द वजाइना बट बहुत बार एबनॉर्मल होता है सो देयर आर टू टाइप्स ऑफ वजाइनल डिस्चार्ज normal and abnormal. What is normal discharge? Because of the normal secretions from the vagina and from the cervix. So they can vary during your menstrual cycle. वो vary करता है आपके period जो आपका cycle होता है menstrual. So ये ज़्यादा हो जाता है थोड़ा सा before menses और थोड़ा ज़्यादा होता है after menses. और middle of the cycle, usually if it's normal, it's watery and clear discharge. There's no abnormal odor in it, smell in it, there's no itching in it. But when it becomes premenstrual, before menses, ये थोड़ा excess हो जाता है, but nothing abnormal. After menses becomes excess, more than normal you feel. So that is after the periods. And in sometimes middle of the cycle, when usually you have your ovulation, ये it increases, discharge increases, it is thicker and stretchy. If you feel it's a stretchy discharge and thick discharge, that's because of the ovulation time. That's a menstrual cycle. And when you go into menopause and you lose your ovaries, stop working, no hormones, no estrogens, so you also start some itching in the vagina. That's because of the dryness of the vagina because of lack of estrogen. So this is called atrophic vaginitis. Usually many ladies they come with itching. They said discharge है, itching है. Discharge is not much of a problem, but itching बहुत है, itching होती है उनको. So that's the usual sign of atrophic vaginitis. That is when you stop menses, you go into menopause, your ovaries start working, and you stop producing estrogen hormone. So that becomes vaginitis. That leads to vaginitis sometimes. It's more in some people. कुछ लोगों में ये ज़्यादा होता है. So this is a normal, and sometimes it's blood stained immediately after your periods, maybe immediate before your period, and when you are sexually active in that period, there can be a bloody discharge, some staining, some spotting, some bloody discharge, because that is also normal. But we talk what is abnormal. Abnormal discharge, when you suddenly start feeling your discharge is excess and the color has changed and the smell has changed and there's a lot of burning, lot of itching in the vagina. So that could be a warning sign to go to a doctor, show to a doctor, because that is an abnormal discharge which gives you abnormal symptoms. So ये discharge भी काफ़ी तरह का होता है. So it can be bacterial infection, infective discharge, bacterial infection. The bacteria normally lying in vagina when they lose their balance or they overgrow due to some reason. So that becomes infective discharge, excess discharge. That is bacterial. It can be little watery, it can be little grayish in color, it can give you itching also. So that is a bacterial, that is the most common discharge when you have infection overgrown in the vagina, and that leads to excessive discharge. That is abnormal discharge, which we call it bacterial discharge. And second variety can be the when you have lots of itching, fungus. It's a yeast infection in the vagina. The normal yeast lying in the vagina, which keeps your vagina healthy, so they overgrow due to some reason. So they overgrow, either you are pregnant or you are diabetic, or there are some other reasons, long term of eating steroids and antibiotics. So that gives abnormal yeast infection in the vagina. When you have lot of itching और खूब सारी burning होती है, burning of when you pass urine, there's a burning, there's a lot of itching, irritation otherwise in the vagina. So that could be, and it's a white discharge, usually a cottage cheese like thick curdy discharge. So that is the difference in the shape, in the color of the discharge, in the quality of the discharge. In yeast infections, that is really a thick discharge, whitish, maybe a curdy discharge, or maybe a cottage cheese like discharge. So that's a yeast infection. And the third one can be trichomonal. There's a protozoa called trichomonas, very common infection in ladies. So it causes itching, it causes excess discharge, maybe a whitish, maybe a little greenish discharge. So it's excessive discharge giving you itching, or maybe giving you lot of irritation in the vagina. So that could be linked with the sexual transmission. So if your partner has this problem, you can have. If you have, your partner can have. So that's a sexually transmitted infection. And then there can be chlamydial infection. There can be gonorrhea, which are sexually transmitted disease, which you catch from your partners, and especially if you have multiple partners, sexual partners. So it's more common in those people. So they are linked with your sexually transmission disease. That's a transmission disease, sexually transmitted disease. So these are called as maybe a chlamydial, there's an organism, and maybe it's a gonorrhea. So it says syphilis, gonorrhea, these are the sexually transmitted diseases which can be caused by partners, more common in the people with multiple partners. And then it can be infection, transmitted infection, which is called HPV, human papillovirus infection, which can lead to cervical cancer. And you know that there's a vaccination coming for this. So we are giving vaccination. You can start from the 10 years of age, before the girls become sexually active. Give them before that. So that will protect you from this HPV vaccination most of the time. So we do Pap Smear, we do water test from the vagina, which is called Pap Smear from the cervix. We take the discharge to exclude this disease, to avoid this disease which can lead to cervical cancer. So this can be also sexually transmitted. And so we should be very careful how it happens, how the abnormal discharge happens. Suddenly you start feeling excessive discharge and change in the color, change in the odor. If it's a bacterial infection, there's a lot of foul smell, fishy smell from the patient. When the patient lies down on the table, you can smell from the outside only that patient is suffering from this infection. सो वो चीज़ जल्दी ही पता लग जाती है कि ये डिफरेंट तरह का स्मेल आ रहा है डिस्चार्ज, और पेशेंट से डिफरेंट तरह की स्मेल आ रही है वहाँ से. सो दिस इज़ अ abnormal type for discharge happen. What kinds of even cervical cancer we have? If suddenly you start feeling your discharge is becoming blood staining without any reason, and there's a intermenstrual bleeding in between. When you have vaginal discharge, there's always a bleeding. Menses के बीच में bleeding है, after the sexual relations bleeding है, and you otherwise also without any reason you have the bloody discharge. So that can be warning sign. You have to go for your Pap Smear, you have to go for your investigations from the doctor to avoid what is cervical cancer. So avoid the cervical cancer. So I recommend the cervical vaccination for these people. For all the ladies rather up to 45 years of age, we must have this infection. So the chances of increase in vaccination can be in your stress. If you have any stressful condition, it is more in the stress. And when you have longer period of eating antibiotics, more than 10 days, more than 10 to 15 days, so there are chances of yeast infection in those patients. So these are the reasons. And if you are on birth control pills, that can lead to vaginal infection, excessive discharge, fungal infection. And if you are pregnant, the chances of fungal infection are more. If you are diabetic, the chances of fungal infection or vaginal infection is more. Or longer user, as I told you, the chances of fungal infection is more. Because many patients, they have without reason the fungal infection. If you ask the history, कि डिड यू टेक एंटीबायोटिक्स, पिछले कुछ दिनों में एंटीबायोटिक्स का कुछ कोर्स किया है, हाँ जी हम तो बहुत देर से खा रहे हैं, सो उनमें ये चांसेस होते हैं फंगल इन्फेक्शन होने के. और पेल्विक इन्फ्लामेशन, बहुत पेशेंट्स आते हैं पेल्विक इन्फ्लामेटरी डिजीज़ के साथ. लोअर pain in the lower abdomen, lower abdominal pain in the patients, sometimes fever, sometimes other symptoms of infection in the body. So that can also give rise to excessive discharge, or the excess discharge, it gives rise to these symptoms. So that needs attention from a doctor, okay? And when you need the doctor's advice, I'm telling you कि suddenly अगर आपको लगता है आपका डिस्चार्ज ज़्यादा हो गया है, उसमें थोड़ा कलर चेंज हो गया है, चेंज ऑफ कलर इन द डिस्चार्ज, थोड़ी स्मेल चेंज हो गई है, बैड स्मेल आने लग गई है, इचिंग शुरू हो गई है, कभी कभार फीवर हो जाता है, पेन लोअर एब्डोमेन में चल रही है, तो ये वार्निंग साइंस है डॉक्टर को मिलने के, कि आपको पता लग जाएगा कि व्हाट इज़ द रीज़न बिहाइंड इट. और यू हैव बर्निंग मिक्चुरेशन, सो ये भी एक रीज़न होता है कि पेशाब लग लग के आ रहा है, या पेशाब करने के बाद एकदम बर्निंग शुरू हो जाती है. सो ये भी एक सिम्टम है पेन लोअर एब्डोमेन में होने का और वेजाइना का इन्फेक्शन होने का, इसमें भी. सो how can we avoid, what is the basic thing to avoid these infections? वजाइना को कैसे केयर करना है, क्योंकि बहुत सारे ये वजाइनल वॉश आ गए हैं, सोप्स आ गए हैं, और बहुत सारी चीज़ें आ गई हैं. और एक तो douche, वजाइनल douche करते हैं बहुत लोग, नहीं करना बिल्कुल घर पे. It's not advised. Vaginal douches are not advised. Don't use any perfumed vaginal discharge. Don't use any perfumed soaps, any hot water baths. You sit in the hot water baths and enjoy yourself. So try to avoid those baths also, and avoid vaginal sprays. Things having chemicals, they can give rise to infection in the vagina. So any perfumed soaps and bathing moisturizers or lotions, and then perfumed vaginal sprays and vaginal douche or vaginal tampons. So if you use vaginal tampon, just be careful that you remove them in time. ज़्यादा देर उसको नहीं रहने देना और भूनना नहीं है. बहुत बार टैम्प्यून रख के आप भूल जाते हो तो वो बहुत बैड स्मेल विजाइनल में बहुत इन्फेक्शन होती है. विजाइना की इन्फेक्शन अगर ज़्यादा हो जाती है वो आपके यूट्रस तक चली जाती है, यूट्रस में इन्फ्लामेशन देती है, ट्यूब्स में चली जाती है. सो कई बार प्रेगनेंसी में इनफर्टिलिटी का रीज़न कई बार ये होने लगता है. सो जितनी भी जल्दी आपको लगता है कुछ अब नॉर्मेलिटी है आपके वेजाइनल डिस्चार्ज में, तो यू मस्ट बी केयरफुल, गेट अलर्ट दैट यू नीड चेकअप और यू नीड अ पैप स्मीयर और यू नीड समथिंग. सो यू मस्ट नॉट इग्नोर योर वेजाइनल डिस्चार्ज. लेडीज़ बहुत इग्नोर करती हैं अपनी इन्फेक्शन को. बहुत देर से पूछो कब से डिस्चार्ज है जी, बहुत देर से पानी पड़ रहा है जी, क्रॉनिक पानी पड़ रहा है जी. वो क्या होगा, उसमें इन्फेक्शन बढ़ेगी, वो अपवर्ड जाएगी इन्फेक्शन आपकी. सो उसमें यूट्रस इन्वॉल्व हो जाएगा, बाकी के प्रोडक्ट जो ऑर्गन्स हैं जैसे ट्यूब्स एंड वो इन्वॉल्व हो जाएंगी, उसमें आपको प्रॉब्लम आनी शुरू हो जाएगी. सो डोंट ट्राई टू इग्नोर योर ओन प्रॉब्लम्स. लेडीज़ अपनी प्रॉब्लम्स बहुत इग्नोर करती हैं. सो ये एक बहुत बड़ी वार्निंग है vaginal infection की. One should be very careful for vaginal infection. Even it can occur, bacterial infection can occur in unmarried girls. It can happen in unmarried girls if they don't care. They'll use lots of vaginal sprays and chemicals and smelling soaps and baths. So try to avoid that. Young girls के लिए भी बहुत careful होना पड़ेगा. मदर्स को ध्यान रखना पड़ेगा आप बहुत सारा. और अब जब भी वॉशरूम जाते हो अपने का आपको ड्राई रखो, क्लीन रखो, क्योंकि ये दो चीज़ें बहुत इम्पॉर्टेंट हैं. यू हैव टू क्लीन योर सेल्फ एंड देन यू हैव टू ड्राई योर सेल्फ. उसकी जो डैम्पनेस है वो नहीं होनी चाहिए आपकी अंडरवियर में, अंडर क्लोथ्स में डैम्पनेस नहीं होनी चाहिए. दैट गिव्स राइज टू प्रॉब्लम्स. So try to make it clean and just keep it dry. ये ध्यान रखना पड़ेगा. और कोई टाइट अंडर क्लोथ्स मत पहना करो और सिंथेटिक मत पहनो. वो कहते हैं ब्रीद, योर वजाइना शुड ब्रीद. सो वो मटेरियल यूज़ करो जिसमें एयर अच्छी तरह से घूम सकती है. कॉटन के अंडर क्लोथ्स यूज़ करने बेटर होते हैं और टाइट नहीं ज़्यादा पहनते. स्विमिंग सूट्स जैसे होते हैं, किसी का आप बोरो कर लेते हो, कुछ और बोरो कर लेते हो, अंडरवियर कुछ ऐसी चीज़ या बोरो करते हो. सो जस्ट बी केयरफुल कि उसकी इन्फेक्शन आपको ना आ जाए. सो टाइट अंडर क्लोथ्स नहीं पहनो. कीप योर वजाइना ड्राई एंड क्लीन. And in case you find any abnormality in your vaginal discharge, और हमेशा वार्निंग सिग्नल समझो, डॉक्टर को मिल लो. डोंट इग्नोर दिस. इट कैन बी वेरी माइनर थिंग्स बट डोंट ट्राई टू इग्नोर योर ओन प्रॉब्लम्स. सो ऑलवेज ट्राई टू मीट अ डॉक्टर दैट यू हैव सच प्रॉब्लम. सो आई एम स्टिल here to just if you have any questions to answer your questions, you can always ask for any question to me. I can just clear the things and help you. This is the only purpose, to help the people, help the patients. So I'm here to help if you have any problem. If you have any doubt that whether I should go to the doctor or not, whether my discharge is normal or abnormal, whether my pain abdomen is normal or abnormal. So just be careful and always try to use some protection during your sexual intercourse. Try to use the protection so that you don't have these sexually transmitted diseases. You are saved from those things. Neither you give your partner or your partner or nor your partner gives you. So that's only if you use protection every time or condom or whatever you want to have. Protect yourself from infections happening around. So, my dear friends, if you have anything, any doubt, I can always talk to you. Don't get panic. There's always a solution, and the cervical cancer does not happen so easily and so quickly. You can always meet your doctor to just exclude your doubt. So, and try to avoid with the vaccination to avoid cervical cancer, and start from your young girls at home, the vaccination. So, I hope mm, quite simple words I have talked to you, because this is a very common, usual problem which we sit in the outdoor and see the patients, vaginal infection. Right. So, if you have any question, you can just send me. So, no questions, no doubts.
Hello, doctor. I don't think there are any more questions.
Okay, okay. Anything else? Okay. All, all have good experience of vaginal infections. So, should I continue or stop? Hello?
Yes, doctor, you can stop. I guess we can stop for now because I don't think we have any more questions.
Shall we stop it then?
Yes, doctor.
Uh,
That'll be fine.
there's no questions? Okay. All right. Thank you. Bye bye.
Thank you, everyone.
Bye.
Bye bye.
Bye.